Last year, we started some research about the role of androgens. The first link that we had was there were increased severity of COVID in patients who were bald. They had androgenetic alopecia. That initial clue led us to research some medications for COVID. We started having some retrospective studies, and we saw that in patients in Spain, they were admitted and they were taking this class of medications called 5-alpha reductase inhibitors. They had less chances of ending up in the ICU compared to the population that was in the hospital not taking those medications. There was an article that was published in the Journal of the European Academy of Dermatology and Venereology last year. We had 2 articles that were picked as the editor's pick for the year of 2020. By the time those articles came out, we were conducting randomized placebo-controlled trials in Brazil on the patients who had mild COVID. They were having some symptoms, so they were randomized in 2 groups. We already detected that the patients who were taking antiandrogens, they had less symptoms. Their viral load in 7 days was reduced with antiandrogen medications. And also, in a subgroup of the analysis, which was the strongest blocker of the male hormones, we detected that there was less hospitalizations. That medication that we studied is called Proxalutamide. It's a strong blocker of the androgen receptor. So basically, when the patients take this medication, all their male hormones stop to work within some hours. We had a very interesting case report, which was published in the British Medical Journal, about a man. He was a bodybuilder and he had very severe COVID, and he started this medication that blocks the male hormones. And in the next day, he had no symptoms. His smell came back and oxygen saturation levels had improved. And also his cough, basically all the symptoms were gone within 1 day of the medication. We were testing these medications on what we can consider early cases or maybe mild cases of COVID, and we were detecting a big difference between placebo versus antiandrogen medications.